Welcome to the Radiology Review podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
Welcome to this bonus episode of the Radiology Review podcast. On this episode, I wanted to discuss some of the leading trends in radiology in 2022, and I have with me today two of my friends and mentors in radiology joining me to share their thoughts on the year 2022 for radiology. First, we have Dr. Phillip Kuo, who graduated in chemistry from Harvard University and then earned an MD PhD from the University of Virginia. Dr. Kuo completed residencies in internal medicine at UCLA and nuclear medicine and radiology at Yale. He is a professor of medical imaging, medicine, and biomedical engineering at the University of Arizona, where he previously served as chief of nuclear medicine for 10 years. As a consultant, he provides expertise in design, conduct, analysis, and reporting of phase 1 to 3 clinical trials, and he has more than 100 peer-reviewed publications and has served as PI or a co-PI on numerous NIH grants and industry-sponsored clinical trials. We also have Dr. Ryan Avery, who is currently an associate professor and chief of nuclear medicine in the Department of Radiology at Northwestern University. He completed his residency in radiology at Albert Einstein College of Medicine and completed fellowships in nuclear medicine at Columbia University and cardiovascular imaging at New York University. Dr. Avery has received numerous awards for radiology education and has been nominated multiple times for the Most Effective Radiology Educator by AntMini.com. To give you an overview of topics we discuss, this includes the radiology job market, shortages in radiology, including things like iodinated contrast and technetium, the return of in-person meetings and conferences. We discuss theranostics in nuclear medicine, cardiac imaging protocols, and supplemental screening in breast cancer, as well as important topics such as burnout, teleradiology, and we finally share a few thoughts on the immediate future of radiology. As Dr. Avery concludes at the end of our discussion, quote, "We're in for quite a roller coaster ride, so everybody hang in there," end quote. I hope you enjoy this discussion, and without further ado, here we go. Ryan and Phil, thank you for joining me today for this special episode of the Radiology Review podcast, where we're going to talk about some of the major themes in radiology in 2022. And I want to start by talking about a topic that is very high in interest for radiology trainees, which is the job market. And in my estimation, we have a super hot job market. In fact, this is the best job market I have seen since I entered radiology as a resident. What are some of your thoughts on the current job market situation? Let's start with Ryan, if I can.
Sure. It has been very interesting times. When I came out looking for jobs, it was around 2010. Around 2008 with the recession, that job market was the complete opposite. And it's changed actually so much of the way residents are looking at jobs, thinking about jobs, and what they're prioritizing, because really there's just so many jobs out right now. And, me being in academics, it's been very difficult to actually attract residents to think about academics because they see so much money available in private practice right now that a lot of residents, while I think, personally could be very, very promising, or maybe have even thought about academics through a lot of their residency, are now being enticed away to think about doing private. So it's made it extremely hard to attract and compete with the job market right now. It's unheard of. And I had this kind of woe is me approach for the longest time. I thought it was just me and, just my own particular circumstances and, where I worked, which I thought would be very attractive to bring in positions. The most important thing that I think is that when I went to RSNA to see and talk to so many people who felt the exact same way I did, and just across the spectrum throughout radiology, from every subspecialty, from multiple different academic institutions, and additionally even people who are in private. This job market is so crazy that it is just we don't have enough people coming out of residencies to fill it.
I think that's a really good perspective. I think the job market is crazy. It seems everybody is hiring, whether academics or private practice. I also know there's a lot of demand on the clinical research side as well. Phil, what are you seeing on the research side in terms of the job market?
Thanks, Matt. Ryan's points are spot on. And, I started my residencies back in 2000, and the job market was just really hot in that time period, too, in the early 2000s. And to echo Ryan's sentiments, in radiology in particular, that's when academics gets nailed pretty hard because the job market opens up for private practice, and the salaries, especially if you're coming out of residency with a lot of debt, as many of us know, it's hard to turn that down. And that trickles into the clinical research. I mean, clinical research is not exclusive to academics. Clinical research is done in what we would call private practice. I think that's a strange term nowadays, because I think things are kind of blending together. I think a lot of academic practices are becoming very much like a private practice model. But let's just say that traditional non-academic definition of anything outside of a university hospital is actually starting to do more clinical trials and research and support it. But without academics, the main driving engine, it certainly is an issue. And academic radiology does tend to get hurt in a tough job market. As Ryan said, it's across the board. Everyone's having difficulty recruiting. It seems like we are not getting enough residents out. At best, maybe we would say it's a 1-to-1. Obviously, we had a lot of early retirements with COVID, which really changed the dynamic of how many people we needed in areas. And it doesn't take much of a shortage to really impact it. And I think, Matt, one of the things that as residents who are going to be graduating soon is a lot of your podcast audience, be prepared that when you go out there, you may be able to land the job where you wanted, more so than a few years ago, at a pay that you want, but not to scare anyone. But you're going to come out at a time when the workload is really hard as well. That's part of the radiologist shortage, is that everyone's working really, really hard. But when the clinical workload's that high, it makes it extremely difficult for administration, even if they want to support clinical research, to be able to, just because we have to take care of patients first and foremost.
I completely agree with that. I'm currently seeing residents getting recruited very early in their residency. And to contrast that with when I was a resident, when I entered as a first-year radiology resident, as you know, because we were at the same institution, a lot of our fellows couldn't find jobs. Regardless of what subspecialty they were in, they weren't finding jobs. They were choosing to do a second fellowship. During my entire residency, I never once had a recruiter contact me for a job. It couldn't be more different now. I'm hearing from our residents that they're constantly getting phone calls, unsolicited emails, text messages. I'm looking on radiology job boards and seeing signing bonuses in the 6 figures. It is a very strong job market, and that's a double-edged sword. Like you said, you can negotiate a lot, but once you've signed on the dotted line, residents and fellows need to be prepared to work really hard because they are entering a situation of a shortage of radiologists. And speaking of shortages, I think that is another global theme of radiology in 2022. I personally have seen shortages not only of staffing, but also simple things like lidocaine. We've seen shortages of iodinated contrast. There have been and continue to be shortages of technetium. And it has certainly been a surprising year in terms of not taking anything for granted. Ryan, Phil, have you experienced anything along those lines?
Oh, yes. I'll chime in first. The iodinated contrast shortage was unprecedented and just an amazing thing to have to go through, where I never thought that all of a sudden in short time, it went from a rumor to here's an email that described our plan, action plan, and details, that by the end of the week, we were pretty much using contrast only for emergency uses and doing decently considering. But we were so lucky the way we triaged it, but mainly, because we were using, a predominantly single vendor for our contrast to see one vendor. And it's not like you had that many choices. I think it was really two groups who are making iodinated contrast, to see one of them go offline, and the next thing you know, we're giving minimum contrast to only for emergency cases, which is unprecedented. Same thing happened with technetium. And not to say we didn't have any close calls, but we never, luckily, knock on wood, ever really ran out. But the thought of that getting so close was a little shocking.
Yeah, I can imagine. It's taken a lot of maneuvering by institutions, a lot of creative thinking in some ways to still provide patient care during this challenging time. I appreciate that perspective. I hope 2023 will have fewer shortages of staple items, such as iodinated contrast and technetium. Let's talk about in-person meetings. This has been a year where in-person meetings have really made a comeback. Are we back where we were? What does the future of radiology conferencing look like at the moment? Let me start with Phil. What have you experienced and what are your thoughts?
Yeah, thanks, Matt. The 2022, I think, was a good year. I don't think anyone expected it to be back to 100% to pre-pandemic levels, but I think it was a great transition year to getting us there. And I think it was about 3/4 back. And I think the big question is whether that's more or less going to be the new normal. Are we ever going to get back to those pre-pandemic levels? One of the first big meetings I went to, we had a lot of AV difficulties just because that convention center, we were the first big meeting that it restarted within the pandemic, and it kind of showed. And it was kind of like the supply chain issues were so much what we took for granted that needs to happen correctly. Just one little glitch and it kind of throws everything off. So we had a lot of issues with some of those ones early in the first half of 2022. The last big one, of course, with RSNA, I thought went very well. It was very well attended. It was great to see everything coming together again at such a big meeting like RSNA. It was obviously the second time RSNA has happened in the pandemic, but the year before was a really tough year. There was pretty low attendance, but that was expected. We just needed to, again, take these small steps before we can start running again. But I think 2023 should be a really good year, and I will be curious to see. We know hybrid is here to stay, but I think 2023 will really tell us what's going to be the new normal for in-person versus the online attendance.
Ryan, what are your thoughts?
So continue to go with the same motifs as the pendulums, and just circle back to thoughts in early 2020 of friends and colleagues almost being doomsayers of, oh, this is it, virtual conferences are going to be it from here on out. We'll never see conferences again. It's almost like it'll be antiquated and old fashioned before you know it. There was a part of me, and I just didn't want that to happen. Even though COVID was going on and no one could really travel at all, the thought of having that level of communication and networking that we've known from conferences for so many years, to see that perspective, I found it really dismaying. But what happened was I was really surprised, kind of like what Phil said, that quickly it is coming back. I agree. I think hybrid's going to be here to stay. I think there's been a lot of adoption of it, and I think that's a good thing. I mean, I'd love to go to more conferences this year because of short staffing, I know I will be doing a few of them virtual. But I think the overall component of conferencing and why it's important has really shined through.
I agree. And I think 2022 has shown us that in-person conference attendance is still important. We can't do all of this virtually. And I think the future will continue to show that radiologists are going to be traveling in many cases to attend these conferences. And in my opinion, that's a good thing. Let's go on and talk about technologies. We'd be amiss on a radiology year in review to not talk about some of the technology that is advancing and has advanced in 2022. What are some of the top technologies that are advancing in 2022? Let's start with Phil. What are your thoughts?
Well, I think the big thing that should not be ignored, because as we know in the United States, the vast majority of nuclear medicine, particularly in non-academic settings, is performed by radiologists, whether they are nuclear radiologists, which is a rapidly increasing number, or just straight radiologists. A huge breakthrough was the approval of the lutetium PSMA agent for the treatment of metastatic prostate cancer. And for the first time in nuclear medicine history, it should not be ignored that a theranostic pair was actually approved. So there was a simultaneous approval of the PET imaging agent for PSMA in order to help determine who should be receiving the therapy and the therapeutic itself. And it met both endpoints of overall survival and progression-free survival. So in a patient population with very few options left, it actually was able to improve overall survival by 4 months. We've always been in nuclear medicine a theranostic field. Radioactive iodine is a theranostic, so it's nothing new. But this is going to turn treating patients in radiology and nuclear medicine into an absolutely everyday occurrence. The most recent news is that the prostate cancer trial, which is in the earlier metastatic setting, which is before they receive chemotherapy, actually met its primary endpoint as well. So this is the progression that we expected to see, and it is happening with the most recent positive trial that earlier in prostate cancer, we're going to treat even more and more patients. And I think one of the biggest challenges that is already occurring is how are we going to keep up with the demand, which is a new and powerful problem in nuclear medicine. Thanks, Matt.
Thank you. Ryan, what are your thoughts?
Sure. Coming from my side, industry groups have been approaching our department, from multiple sides, all related to theranostics. Groups who were not very strong or very, had a big footprint in molecular imaging and theranostics all of a sudden want to be in the game because they see how much the expected growth in theranostics is going to be over the next 10 years. It's industry, so that you're looking at dollar signs and they're just jumping on it. So this is going to be big. It's going to be a huge growth market of theranostics. And as Phil mentioned already, lutetium PSMA is blowing the doors off and it's only going to get more rampant. What happens is, how does radiology pivot to get ready for this? I think right now we're a bit lucky because getting lutetium, having a program, being able to reassure the patient that they're going to be able to get all their therapies when it's set up is a bit of a logistic problem. So it kind of keeps theranostics a little bit more in larger hospitals. I know that most academic centers still having a little difficulty getting a lutetium PSMA program set up just because of the logistics of getting the radiotherapy. So I think that's going to be give us a little bit of time to kind of prepare for this, but we really need to be building in a much bigger way as radiology because, as Phil mentioned, in private practice, they've thought of nuclear as just kind of like, something that they just pick up along the side. But when these therapies come along, if we don't have radiologists who are prepared for this as it keeps growing and growing and growing, we're going to be in a bad position because, just for so many years, traditionally, residents have not gone into nuclear medicine for, whatever reasons. I can definitely, see why, especially before, really the growth of PET that, didn't seem as exciting as all these, other fields that were kind of actively growing. So it's an interesting predicament. I think we have some time to get prepared, but if we don't start preparing now, we could really be in trouble 5 years or so down the line.
I want to ask you specifically as well to discuss a little bit about cardiac imaging. What are some of the new trends in cardiac imaging?
So it's been really, really exciting. Probably the biggest and most exciting thing that's happened in cardiac imaging over the last year has been the introduction of the new chest pain guidelines that came out right in October of 2021. And to see how much imaging across the board, CT, MR, nuclear, PET, have all just been incorporated into every step from acute and stable chest pain, and seeing how much it's actually involved, even calcium scores. So to see how imaging is completely just inundated for chest pain, it's really surprising. It's exciting to see all these kind of modalities working together to provide good patient care. Really exciting times for cardiac, which when I started 10 years ago, it was seen as a niche and a hobby, and sometimes really couldn't get the support of your department. I guess, I don't want to point people out, but to have that level of excitement and incorporation of cardiac imaging is massive. I mean, I could go into each and every one of the fields, such as MR, CT, cardiac PET, and just see how much they're all growing, how exciting they are, how they all work in together. But overall, just to see that level of incorporation into how patients are taken care of, in essence, patient shows up in the ED or they show up their clinic with chest pain, and immediately their referring doctor, their ordering doctor are looking at imaging as incorporating how they're going to treat their patients. It's an exciting time to make imaging that much. Even though I wouldn't say cardiac imaging was that hobby component of it was 10 years ago, this felt like we really went prime time.
That's really interesting, and it's reassuring to me to know that imaging is being recognized for the value it offers. With things like chest pain, I think the imaging tools that we have as radiologists have never been more powerful than they are now. I want to just take a moment and speak about some of the trends in breast imaging as well. And I would say the main themes in breast imaging for 2022 are the rise in supplemental screening on a national scale. Especially recently, Katie Couric, well known in the United States, was diagnosed with breast cancer and has really spearheaded a push for increased awareness and acceptance of supplemental screening, meaning screening beyond mammography or tomosynthesis, things like whole breast ultrasound, MRI. I would also add in contrast enhanced mammography and molecular breast imaging. There's currently national legislation being drafted, which I think is really interesting, to guide radiologists and insurance companies on what supplemental screening options need to be available. I think one trend in breast imaging that is solidifying is that we are more than ever a legislated field, meaning that the federal government is really guiding a lot of breast imaging, but that absolutely is happening in screening mammography in terms of needing other technologies to fill in some gaps that are becoming increasingly recognized. The other main theme I would say is that there continues to be a great shortage of breast imagers, and any residents who want a guaranteed job, at least I hate to guarantee anything in life, I suppose, but breast imaging seems like a sure bet. Let's move on to burnout. That has been another leading theme in 2022. I recently saw a study that estimated that the average radiologist needs to interpret one image every 3 to 4 seconds during an 8-hour workday to meet workload demands. And that study was actually from 2019. I suspect the pressure on our time is even higher now. Where are we at and where are we headed?
Phil, why don't you go first?
As you both know, I'm in a little bit of a unique situation right now, but I can definitely say that I hear from all my colleagues that burnout is a major issue, and particularly from my colleagues who are in leadership positions. Trying to do more with less is just essentially impossible, right? But that's what we're being asked to do. The burnout, I think, is really, really high, and it's not just in radiology, it's across the board in medicine. And I think that trickles down so that it strains the whole system. Sorry to just kind of take a pause and just sort of see outside of our field and big picture before we narrow back down to our field. And I think it's a real concern. I think for your audience, Matt, as particularly residents, I didn't mean to scare anyone, but I think it's good that people be prepared that with this great job market, as I said earlier, comes a tremendous amount of pressure when you start. And starting that first job out of fellowship and residency is really challenging in and of itself. Just getting used to all those new challenges of a new practice is always hard, even if you're experienced radiologist, but also if you're first coming out. So when you start your new job, just give yourself a little slack. If you feel like you're really struggling, that's natural. We'd probably be more scared if you didn't feel you were struggling. Matt, burnout and stress and handling stress is something that I think we all struggle with, and it's a great research interest of mine also. And as much as you can, try to take care of yourself and try to learn those habits while you're a resident, I think is really key, because being a resident is very stressful too. I hate to also be a little bit of a realist, but hopefully allow you to be more of a pragmatist, that this burnout issue is not going to go away anytime soon, right? Just like this radiologist shortage is not going away anytime soon. You're going to have to be reading things at a very quick pace, longer hours. And I think physically as well as mentally, you have to take care of yourself. So start to try to develop those habits as early as possible is what I would recommend. Thanks.
Thank you, Phil. That's a really fantastic insight. Ryan, what has your experience been?
Yeah, I am so glad that Phil spoke before me because he brings up so many points across the board. And I feel lately I'm very lucky in my chosen field to be in academics because I find that some of the best ways that I can combat burnout right now is, short staffed, but having the day-to-day interactions with my colleagues, teaching residents, working with colleagues in regards to clinical colleagues who are not radiologists, discussing cases, discussing the complications of the cases. Those are little things that kind of break up the job, make it fulfilling, and really get me through the day. Now, I could keep going on and on of what Phil said is just finding little tricks, it's not even tricks, life lessons of how you can get through the day. I'm a little worried about, people are going to private practice, young residents and are hitting the ground running may really, go all in because they've always been this kind of go-getter approach. It got them this far. And then next thing you know, you're sitting there, at a workstation, going through high volume cases, and I've seen these studies. You are kind of looking at more images. And I feel a little concerned that some of the residents might dive into these jobs and really just kind of hit it the way they've always hit everything and really hit the wall quick because next thing you know, you're just reading a lot of cases, high volume, not having the time to discuss, share, just those little day-to-day, office interactions that, make the work fulfilling. Instead, you're kind of in a grind. One thing, I'll probably get some grief here, but, it's just an opinion, is that, some of my residents, they kind of sometimes approach me and ask me a little bit like, what do you think about teleradiology? And I'm always like very concerned because it's just like they're young. I mean, if there was a different part, they'd kind of establish where they wanted to be more along their career. I might say, from a pluses and minuses if that's a good fit, but some of them, they see, oh, I can read in my own times or, have a workstation in my home. But it's like, do you really want that at the beginning of your career? Because then next thing you know, you lose that collegiality of whatever practice you're working in, how you work with other people. Instead, you're just kind of sitting there, going through a lot of cases, high volume, really fast, and it can really start to wear down if that's how you picked up your job from day one and can't see a kind of a broader take on it. So there's no one right choice. Everybody's going to go into different jobs, and I want to implicate, one's right or wrong because we're all different. But I really, really want to emphasize to Phil's point, it's, go find these, I don't care if it's a clickbait article or 5 ways of, working with work-life balance and really start to mature those thoughts of how can you make it so that you just don't grind yourself into the ground.
I think it's interesting you bring up teleradiology, and that's something I was hoping to discuss in this episode. From my experience in 2022, my opinions on teleradiology have started to shift. I've seen advertising and some information from teleradiology saying that they're actually a solution to burnout, that some practices will let you read at your own pace. Of course, your income will be tied to the pace at which you are reading. I see a lot of residents having more interest in teleradiology. I also see academic centers increasingly consider teleradiology options to fill in gaps in clinical service coverage. And teleradiology is something that everybody should have a close eye on, and I think is also a field that is evolving. We have about 3 minutes left. Let me close by asking each of you, if you don't mind, to make some bold predictions for 2023 or beyond in radiology.
I guess maybe I'll kick it off. And thanks, Matt, for this opportunity to speak to your audience. Your audience is the future of our field that we all care a lot about. And in 2023, I think that the meetings will definitely come back. I think 2022 really made us appreciate how these meetings are important. And one of the things I want to bring up that I think took one of the biggest hits during the pandemic, and that to go on that last theme of teleradiology, I think we should be cautious about, especially if you're coming out first and getting a job in teleradiology, is that the remote doesn't work great for mentorship. And so I hope that emphasis on mentorship comes back in 2023. And I think that burnout will become a major topic. It already is, but even more so in 2023 as the labor shortage really starts to make an even more lasting impact on our field. A lot of coping with stress and burnout is seeing how your mentors have done it. And I think that face-to-face interaction that you need with to make a really optimal mentorship, I hope and I predict will make a comeback in 2023. Thanks, Matt.
All right, Ryan, you have about 1 minute. Do you have a bold prediction for 2023?
Okay, now you went really bold. I think with the continuing fight against inflation. We're going to see interest rates high. And I think by the end of the year, we're going to start to go into a recession. And then I think what happens is how, maybe my own PTSD from 2009, 2010, I think how that recession affects the job market in radiology could be really impactful. I think trying to pick anything of how it goes after that might turn into the butterfly effect. I don't really know where it's going to go there, but I think some of these components of this way everything just keeps going up and up and up. Sometimes what goes up must come down, and I think it's going to continue to impact. We're in for quite a roller coaster ride, so everybody hang in there.
I want to share some concluding thoughts before we end this episode. After this conversation, Dr. Kuo sent me a message saying that a bold prediction for 2023 he wished he included was that amyloid PET imaging will get a positive reimbursement decision now that there is a therapy that was shown in a recent publication to improve clinical scores for Alzheimer's disease. I also want to add that for those interested in burnout, a prior Radiology Review podcast episode was conducted with Dr. Kuo that discusses potential benefits of Tai Chi, and Dr. Kuo has his own instructional videos for beginners under the name Tai Chi MD, which you can find on YouTube. I want to close with a few of my own bold predictions for 2023. To start, one topic we ran out of time to discuss is artificial intelligence in radiology. My bold prediction for 2023 and the near future of radiology is that artificial intelligence, despite the attention it is receiving, will not have a huge impact on radiology in 2023. Now, that may sound surprising, yet I believe it might be true for most of us. That does not mean that in the longer term, AI and machine learning will not transform radiology as we know it. But the point I am making is that, similar to self-driving cars, the true time horizon for AI and machine learning to revolutionize the practice of radiology is perhaps much longer than most want to admit. Therefore, I expect that the way I read cases at the end of 2023 will be extremely similar to how I read cases now, and that any incremental benefit from AI for most radiologists will be, in fact, very small this year. I hope I report a year from now that I was wrong, and now I have powerful AI tools to help me do better at my job. But the realist in me is that this is unlikely to happen, and to date, I have yet to see any AI software package that really wows me. I hope this will change sometime soon, as I think radiologists could use some help from powerful AI tools. I want to share a few additional thoughts on teleradiology. Both Dr. Kuo and Dr. Avery expressed some concerns about graduating residents and fellows taking a position directly from training into teleradiology. But, as Dr. Avery did point out, each individual is unique and there are no absolutes on what is best in regard to selecting the best career path for any individual. I personally do know a few fellows who entered teleradiology directly from training, and from all I can tell and what they have told me, they have been very pleased with this career path. But I agree this may not be right for everyone or even most graduates. One perhaps not entirely bold prediction for 2023 is that teleradiology will continue to expand in size and influence this year. I am seeing a trend toward even academic centers taking on some component of both internal and external teleradiology to match radiologists to clinical needs. I also foresee an uptick in remote breast imaging jobs, which is in many ways a new frontier for teleradiology. Given this discussion that we had today with Dr. Kuo and Dr. Avery, and the need I see for radiologists in general to be more familiar with teleradiology practices, I hope to provide future content on teleradiology, as I think this is a very important topic that residents and fellows, as well as practicing radiologists, probably need to know more about. Finally, predictions can be wrong. Nevertheless, I think predictions for the future are important as these force us to consider our future and hopefully help us thoughtfully and intentionally proceed to make the future as bright as possible. With that, I'll close. I want to thank Drs. Ryan Avery and Phillip Kuo for helping with this episode and volunteering their thoughts and opinions for our learning. I wish a happy and successful 2023 to all listeners of the Radiology Review podcast. Prepare to succeed. I'll catch you on the next episode. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.